Home, the flu epidemic sickening more Americans tonight in many parts of the country. 22 states reporting high activity of flu. The CDC reporting for 1 week last month, nearly 7% of deaths possibly linked to the flu. To prevent it from spreading, some doctors now treating their patients while staying miles away. ABC's chief medical editor, Dr. Richard Besser, shows us the modern-day house call.
It's hitting early and in some places hard. Some doctors are telling their patients who may have the flu not to come in to stop the virus from spreading around their waiting rooms.
Can you look down and can you look up okay?
They're connecting with patients by computer.
Yep, there's no pain.
Like Jennifer McClendon, a physician assistant in Arizona.
I can tell that they're not in any acute distress over the webcam. I can tell that they're breathing well. Basically, treat them based on what they tell us, which is very similar to what I do in practice.
Flu has already killed 15 children across the country. According to her parents, the 17-year-old girl in Minnesota was perfectly healthy and died just days after the flu struck. And this week in northern Kentucky, health officials reporting 2 area children have died, and patients with flu-like symptoms are flooding local clinics.
With the high volumes we're seeing right now, some of our wait times are 2 to 3 hours. This is unprecedented. This is an unpredictable flu season.
And although this year the vaccine is a bad match for the strain of flu that's spreading, doctors hope that it may still give some degree of protection.
And Dr. Richard Besser joins us now. You were saying some doctors don't want to see all of their patients with flu symptoms, but there are some they do need to see.
That's right. If you're a patient at high risk of getting really sick, so anyone over 65, children under 5, pregnant women, or people with medical conditions like asthma or heart disease, they need to call their doctor as soon as they develop symptoms because there are drugs that can be given, flu drugs, but they have to be given in the first 48 hours to work.
Thank you, Rich. And we move on now to a bizarre